Good morning, everybody. My name is Austin Willett. I'm CEO of Different Strokes, and welcome to the 2022 Different Strokes virtual conference. This morning's session is the latest session that we've been running all this week, and I'd like to start by thanking our sponsors, Bolt, Bird and Kemp. We really appreciate your support with us putting on this conference. I'm absolutely delighted this morning that we've been joined by neuropsychologist Dr Giles Yeates, who's going to be discussing all elements regarding relationships post-stroke. We've worked with Giles for a number of years now in a number of areas. He's supported us by doing a number of videos for us previously, by running Tai Chi sessions for us a while, as well as providing ongoing support for our teen and young adult befriending service. And once again, we're really grateful to Giles for giving up his time to talk to us this morning. Just like to start with a little bit of housekeeping. This session is being recorded, but the only people who will be appearing on the screen are myself and Giles. Everyone else, we won't be capturing any details whatsoever of anybody else who's attending. Those of you who are familiar with Zoom will no doubt be aware of the chat function, so please do use the chat function. If you've got any general comments about the session this morning, let us know where you're watching from. Let us know if you've got some sunshine as well, because it's very rainy, certainly where I am in this part of the world today. There's also a Q&A function, so if you've got any questions for Giles, please do use the Q&A function, and please feel free to use that throughout the presentation and not just right at the end, to give ourselves more chance to then answer your question towards the end. We'll then cover, we have already had a couple in advance, but we'll cover as many questions as we can in the Q&A after Giles's presentation. If I could stress, though, that if you do have a question, please use the Q&A and not the chat function, as I'll be more likely to miss it within the chat function. That's it from me in terms of my introduction, and now I'm absolutely delighted to hand over to Dr. Giles Yeates. Good morning, Giles.
Morning, Austin, and morning, everyone. So give me 1 minute. I'm going to bring up I'm going to do a little presentation to introduce some ideas. And that'll be for about 10 or 15 minutes, and then we can get into some discussion and sharing and connecting with each other based on the ideas I've introduced at the beginning. So I'm just going to share the screen to bring up my presentation. Austin is saying that the host has disabled sharing. You might need to do something here. Make me co-host again. There we go. Yeah, got it. Thank you. Okay. Alrighty. Okay, so it's really nice to be here with you all this morning. Sounds like it's rainy in a few parts of the UK, so I hope you're all cozy and warm. And we can think about connection and relationships. And I want to share with you, so I'm a consultant clinical neuropsychologist. I'm in independent practice after working in the NHS for 20 years. And I've worked in community brain injury and stroke rehabilitation. I do a lot of close work with third sector organisations, particularly Different Strokes, as Austin has mentioned. I'm also a couples therapist as well. So throughout my work, thinking about strokes and brains, relationships have been a key aspect of that, relationships of all kinds, as we're going to see. And you may have heard of this this metaphor before, you may have seen this, but I don't think many things beat it, really, particularly in how we think about something happening to one person's brain and the impact of that on all of those around them, all of those who care for them, all of those who are connected and significant to them. So the analogy is this: it's the idea of a boulder that is thrown into a lake and the ripples that emanate outwards. So in this case, it's the stroke is the boulder. It's happened in one person's brain, but the ripple goes through the minds and heart of everyone. So I want to take this as our core idea as we explore the impact of the ripple and what that ripple looks like for everyone concerned. It's a really interesting thing, isn't it? Brains versus the world beyond brains. There are two pictures here, and I often use this when I train my colleagues, neuropsychologists, that we think about stroke and unfortunate brain injury, and we go inwards to the level of the brain. Next to the picture of the brain is what looks quite like a brain kind of image, but in fact it's a river delta from the south of Spain. And I often just show the delta picture to my colleagues and say, what is that? They say, oh, it looks like a brain. And for us to understand, say, the impact of a stroke on a shellfish fisherman in an endangered community in this river in Spain, we need to understand what's happened to the brain, but we need to understand maybe the impact of the stroke, say maybe dyspraxia, difficulties with fine motor control on that fisherman's ability to manipulate the fishing nets working this river delta in Spain, and the impact then on his working relationships, maybe the loss of a work role on his identity in the family and the economic stresses on the whole family. So very quickly, we go from what happens in someone's brain tissue to their lived lives, and their lived lives, few of us live in isolation. We are connected to each other. Even if we were alone on a mountain, we would have memories, ideas of those who've impacted on our lives, for good or for bad. So we're always connected. So these are more pictures of landscapes, ecologies, the world out there that look like brains, parts of brains. And this is how I see, a stroke. It leads to a landscape of relationship strain, disconnection, and distress, where there's no support. The flip side of that is with support, we can all do a numbers game against an individual stroke. We can connect as a couple, as a family, as a friendship group, as a community. Very much the amazing work that Different Strokes do here. We can outnumber strokes. An individual stroke can be like a bully, and we can gang up against that. So the key thing is here finding ways to connect with other people and respond to the disconnection, the strain that strokes and other brain injuries put on relationships. So many people may know what this feels like, to be suddenly far apart from people we love and connected with following a stroke. Both the relative, significant other, partner, and stroke survivors can feel like that. That maybe when they're in a room, when they're surrounded by people, they can feel like the most lonely if communication difficulties or cognitive difficulties make the presence of lots of other people in a noisy room more overwhelming and challenging than comforting. So it can be the sense of disconnection and distance can be a powerful shared feeling. And that ripple can go through families, it can go through communities. We are all connected, so we have to see how this ripple works. So let's spend a bit of time just kind of I was going to do some overview of the research on relationships following stroke and other forms of brain injury, because it's very similar. But I don't think anything that I'm going to say is going to be news, but maybe putting it all together in the same way will really highlight the scope of the challenge that confronts survivors, they're significant to them, and people like myself who support those networks. So we started, there are a load of blobs here. Let's start off with the green blobs. The stroke survivor. The stroke survivor has a block or a bleed. And from that impact on the brain tissue and the brain circulation system, here is the ripple. Here is the fault line that emanates out through all the relationships that connect to a survivor. So if we go around it in turn, so I'll start off with family groups and work our way around. So at the very bottom, we've got child relatives. Now, children where mum or dad have a stroke, they often receive they're least likely to be regular stroke-focused family support. And there's huge adjustment challenges for children to make sense of what's happened to mum or dad. And it depends on the child's age, how they can cope with that, and what way they make sense of what a stroke is and the changes for mum or dad. And then we have a partner or a spouse, and I've done a lot of work with different strokes on romantic relationships and sexuality after brain injury and stroke, and there's a really core disconnection to the emotional connection and relationships. Hearts are broken. People who are once lovers and the closest to each other become strangers without support, both in terms of the emotional connection and physical connection in the relationship. Moving around, we have siblings, siblings and parents, other family groups that when I've had the privilege to work in a community neuro rehab service that offered family work as our core business, the people we saw least were siblings of stroke survivors. And siblings are often the most important people we could see sometimes, but they often get overlooked and are a few steps away from the experience of a stroke survivor's recovery journey. And adult parents, and maybe aging parents of adult stroke survivors, again, can often be overlooked by health and social services based systems. We have friendships. I'm really pleased to say that there's, in the research world, friendships after stroke and brain injuries is becoming an important focus of research, and more people doing studies on it. And you know, it makes sense, but the academics have been slow to pick up on studying friendships after stroke. And there's been some really important studies recently on things like loneliness, and how there's different types of loneliness. There's loneliness when no one is around in your life, but then there's a particular kind of loneliness when you're surrounded by people who don't understand you, or where communication with those people is problematic. That the very presence of people can make you even more lonely, even though you're physically in the company of people. And again, you know, the presence of friendships can be a really important component and can help the coping of, say, the family group, and can be importantly different to close family or couples relationships. So friendships need to be supported too. And of course, we have, you know, the impact of new friendships that are formed following a stroke. And maybe many of you have connected with other stroke survivors and made new friends on a basis of mutual understanding of lived survivors, lived experts, what it's like to have a stroke in your life in a way that I cannot understand in a lived way. Work colleagues. I do a lot of work on supporting people back into work, vocational rehabilitation, and there can be a strain on work relationships. Work relationships are complicated. Understanding the hierarchy of different relationships in the workplace, the different social etiquettes and behavior required by a formal boss versus an informal boss, versus work colleagues who you know really well, you can almost call them friends, versus work colleagues who you don't know so well, maybe colleagues that you don't like, but you have to remain civil and respectful to. Customer-facing relationships, in particular work roles, they're really complicated, and understandably, they can take a strain themselves. And the return to work data can often shows that someone might be able to do the job, but it's actually managing the workplace politics and work relationships that can cause either demotion or loss of a work role. And broader leisure groups. There's been some really important research from Exeter University looking at how being a member of different leisure or hobby groups following stroke and other forms of brain injury, it's really important for re-establishing a sense of identity and self following a brain injury. But research has also shown, and many of you know, that accessing community groups, making a journey to a community group, working with, say, the provider of an exercise class to make the right kind of adaptations, or or hobby class, right type of adaptations to allow a stroke survivor to participate fully in a group, that can be really complicated negotiations and often leads to disappointment. I think doing the online sessions of different strokes has been really interesting to allow people to connect with something like Tai Chi or exercise groups without the need to make a physical journey. But of course, online sessions bring their own challenges as well. So I've kind of gone around all of the there are the research studies that reflect everything I've just said. We know that when you support child relatives, the rehabilitation outcome of the survivor improves. When we support partners, we know that there's a huge impact for mental health of the survivor. And many people want better relationships of all kinds and to re-establish friendships and have a meaningful work role, be it paid or voluntary, and often that's enriched by the people around you that you share time with, and leisure groups. So we know that if this can go well and be supported, it has a positive impact on the survivor themselves, which we have to make this kind of argument with funders and things like that, people don't understand why relationships should be a part of stroke rehabilitation when it's about a stroke in an individual's brain. So you have to make these kind of circular arguments that actually working with the relationships helps the survivor. And of course, talking this way, it's clearly obvious that this is win-win when supported, but typically it's not supported. And we have increasing distress and mental health needs of these other people, of child relatives, of partners. Research has shown that many partners of stroke survivors are clinically anxious or depressed, suffering with trauma. And when you put all of this together and connect it all, there is a huge healthcare bill and cost for supporting all of these people, but it's never seen together. It's all seen in pockets. The ripple is not seen, just different parts of the lake. So GPs, for example, might be responding to partners' mental health difficulties and distress by offering antidepressants, but not thinking about the partner and the survivor's shared journey together. Child relatives may be attracting attention in the school system, focusing on their behavioural learning without thinking about the impact of mum or dad's stroke. They're all seen in fragments, not the bigger picture. Because you put the bigger picture, the rationale for investing money into this is huge. But we live in a world that's blighted by short-sighted thinking, as the politics keep showing us at the minute. So getting people to see the bigger picture, anything is so difficult right now. Myself, my colleague Christian Salas have just kind of also noted this trajectory, this path of survivors' significant others over time, and it can be a bleak one. That has an idea, something called attachment theory, where people, as warm-blooded furry things, mammals, we share this with our animal cousins, our mammalian cousins, that when we are distressed, we seek the proximity of a caregiver, someone we love, to ease our distress. We turn to people. We are hardwired to do that, to turn to people for comfort when we're distressed. But if that distress is located in the relationships themselves, and there's this ripple, this wave that erodes away, then the people we turn to for comfort, they're distressed. And there's an increasingly widening ripple over time where everyone gets more and more distressed, and are less able to offer support and comfort to each other. So this becomes a very insidious, eroding ripple that depletes everyone around the kind of fallout zone of one stroke in one person's head. And no one is attending to the ripple as a way of thinking about support. Very few people in healthcare settings anyway. I think people are more enlightened in third sector because people can see the longer and bigger picture of this. So I just do want to bring it back to the stroke survivor, that stroke survivors talk about being fragmented, being in pieces, and needing some ways to be put back together even momentarily. And the trend in most services is to focus on the individual shards, often different services with different pieces or fragments, different pieces of glass, and not attending to the splintering process, the not trying to put everything together, all the pieces together, and see that bigger picture. So that compromises that the response of the services leads to further fragmentation for survivors. Significant others, partners, relatives get excluded. And I think clinicians ourselves, we end up fragmented because we only see small pieces, and we can be blinded to the bigger picture and how our particular piece that we're working on fits in with another piece somewhere else. An idea of us coming together across services and groups to see that bigger picture is less and less likely to happen, I think. I think there's a cultural pattern to this that particularly in Northwest Europe and North America, we tend to we have a way of focusing on ourselves as individuals, as islands. That's a cultural pattern. It's not the only one. There's a concept called Ubuntu from Africa, African traditions, which is basically defined as I am because we are. And supporting and nurturing relationships outside of survivor, the relationships in the survivor's internal experience, is conducive to strengthening the identity and mental health and well-being of the survivor themselves. So it's not either or, it's both and. So moving it to the next bit of this, how do we support this? How do we support you guys to stay connected with each other and turn the tables on strokes and play this numbers games? Concept of resilience is important, right? The idea of sometimes from the stroke, to be struck down in the classical sense of the word stroke, is to find a way forwards, and that might be one step backwards to take several steps forwards. It might be like this tree, bending but not breaking. It might be recovering the everydayness, the everyday qualities of life that a stroke has taken away. And I think, people like myself offer dedicated couples or family or community-based therapy support, but finding ways to make a day seem like a normal day or a new normal day, less impacted on by the stroke, is so important. Finding resources to help people reach out to each other, to mutually strengthen and find their way forward and enhance resilience all around is key for the survivor, for partners, for children, for grandparents, for friends, for work colleagues, everyone connected this to who have been affected by the ripple. So I'd like to just point out some resources that are immediately available to all of you to get connected with the conversation. So with different strokes, I've done some work on relationships and sex after stroke in particular. I think different strokes were pioneers to open up this conversation following stroke. And I know this has been acknowledged by professionals all around the world, of colleagues in Australia that have valued the work that Different Strokes have done in this regard. So do check out the videos and the discussions that have been developed around relationships and sex following stroke. Talk about friendships. The befriending service, again, I think for younger stroke survivors, is again being a pioneering move by Different Strokes. And for those of you who feel isolated, the idea of picking up the phone or a video call or a social media message exchange of another stroke survivor, that to me is a core way of stopping that ripple going any further and using connection to move forward. You know, feeling understood by someone who gets it in a lived way is not anything that I or my clinical healthcare colleagues can offer in that way. We offer different kinds of support. We can't say to survivors, say, I know exactly what it's like for you, or this might relate to my experience that way, but other stroke survivors can, and we're very fortunate to have some amazing stroke survivors work with Different Strokes that offer these kind of services. A shout out to other charities as well. So a few years ago, I worked with Headway to release a series of leaflets on relationships after brain injury, which is a stroke is a form of brain injury. And in case any of you have not seen this, do check this out. We've written information leaflets for most of the main roles in the family. So we've done kind of head injury, brain injury for grandparents and things like that. So do check these out. You can maybe, if you have someone in your life who's not understanding the basics of the impact of stroke and the range, you can maybe find that a leaflet for them might be a useful kind of first step in connecting and help get them on the same page as yourself. My website here, I've kind of collated all the resources that I've done across third sector, across different charities. So you'll see a link to my website on the last slide, and the URL is at the top of here. So I put together all of the info packs and videos and webinars that I've done in one place. So if you go and check that out, if you're a survivor or a relative or a partner, you might find something there that's useful for you. And I hope these, we're in a process of connecting today, aren't we? Here we are coming together. I've said my piece. I'm looking forward to hearing about your ideas, your thoughts, your experiences. Maybe we can continue that process of connection today, as will be the case across the week in this amazing conference. So here are my contact details. If anything that you've heard today has resonated with you, or you want to talk about things further, do ping me in the email. I'm very happy for that to happen. And maybe a question of me responding directly or offering signposting to services in your area. In my website here, ripplingminds.com, this is the theme of the ripple. You can get all the resources that I mentioned as well. So thank you so much for your time.
Giles, thank you so much. That was absolutely fantastic talk, and we've had a number of comments come in on the chat while we've been talking, and one or two questions as well. So thank you. I wonder if we could start with a question that came in advance, and that's: I would welcome tips on adjusting to disability. My husband is disabled after a stroke and struggles with this because we have young children.
Yeah, it's really important. That the word adjusting is really important, isn't it? Because often it gets said without a clear idea of what that involves, and it often gets linked to an individual. But this person has a link to adjusting as a process. I don't think there's an endpoint to that process. It's a constant process of change, adaptation, updating, and they mention the other people in their life, her husband, a partner, and children. So there's a need for adjustment and adaptation, adjusting for everyone. And it may be that people's movement in that is at different speeds or doesn't quite connect. So finding where are we at now is important. What I would say is, don't assume that it's done. Maybe if you found a point of understanding, you've accessed information, or you found some connection with other people at one point in time, that you're done and dusted. Maybe 6 months later, actually you need to do that again because the issues that confront you are different, or the situation is different. And with multiple people in the family, that's going to be lots of plates, isn't it? So one person might be in a good place, but kids are getting older. Their needs for understanding, say, dad's disability will change as they get older. And as you move forward as a couple, that's going to change. So I think the idea of this is a constant process. We need to keep checking in with each other, and maybe we need to check in with other people for different kinds of information support at different points in time. And I think those who support families after stroke should understand that this isn't a done deal. This is, unfortunately, many healthcare services for stroke end their input prematurely, but those supporting people in community, I think, in third sector, see this as a long haul, and that people understand how to come and revisit issues, or different issues might present themselves every few months. I mean, I think this giving permission for that is important.
Yeah, thank you. We've got a couple of questions that kind of follow on to this, actually. One of the questions, obviously this first question referenced children, and we've had a question asked by someone that says, I have a 3-year-old and a 6-year-old, and they've received a little bit of literature from us. So I'm really pleased that you've benefited from our children's resource packs. But Giles, you aware of if there might be other support groups aimed at young children?
Yeah, I'm not aware of support groups. It's more of a question of one-off events that happen. There used to be, again, COVID has a bearing on this, doesn't it? There used to be different gatherings of child relatives offered by particular groups of people, different charities. I'm not aware of any at the minute. I mean, that's maybe something that will, happen again as we do more things face to face, or maybe it's going to be possible online too. What I would recommend is a series of books by Jo Johnson. Jo Johnson is a psychologist and a writer, and she's written a series of books on helping children understand about parental brain injury, and there's some aimed at little kids. There's a book, Why Mum Bakes the Best Cakes and Why Dad Builds the Best Boats. And then there's a book later on for teenagers. So Jo Johnson, JoJohnson. I'll put it into the. Shall I put it into the Q&A?
Yeah, if you could, that'd be great. Thank you, Giles.
Okay. Ooh. I think I have to put it into the chat. I can't see a way just to put in something.
Yeah, if you just pop it in the chat, and then everyone will be able to see that. It'd be great. Thank you.
So, or if someone, while I'm chatting, I don't know if anyone else could just pick up the website, but I'll put in.
Yeah,
I think
I know there's a couple of colleagues of mine who are on the call doing so. If one of them's able to look at the details and pop.
So I put in Jo Johnson. That's her name, and it might even be jojohnson.com that will find these books. They're definitely on Amazon and things as well. Right. But they're great resources for different ages of children to support.
Sure. The next question, and I think this sounds like the person who's asked this probably has a teenage son or daughter. Other than saying I'm grumpy, I've had a brain injury to a teenage child. What else can we try and do to explain the very difficult effects, and also try to understand how they feel?
Yeah, that's That's a really difficult process, isn't it? What I would recommend, well, say if possible, is start from where they're at and say, and find out what's hardest for them. What are the most hardest times, hardest moments, occasions for children? It might not be what you think. People might think this is the most difficult bit, but actually, the child might say, actually, it's when this happens. So, kind of having someone support that conversation, say, when does the stroke get in between you and mum and dad? You know, for you, and it might be surprising, and that surprise. Oh, might think actually I'm worrying about the wrong thing here. So I think opening up the conversation is really important. But you're right. If it's a conversation about grumpiness, it might be finding out, what leads the grumpiness to take over the family. Is it when everyone is tired after too long a day? Is it when things are noisy in the background? Is it when, there's a really difficult day in the week where it's a really long, tiring school day, and for mum and dad it's been a really difficult day as well? Can you find a time in the week where grumpiness can't touch the family? You guys can take a holiday from grumpiness and say, actually, we're a bit more restless today. Let's actually enjoy each other and catch up with each other. So I would say just finding out where they find things most difficult as a starting point.
Giles, one of the things that I loved about your presentation was that it focused on relationships beyond just the nuclear family, because sometimes when we say relationships, we might just think of our partner, our husband, our wife, or possibly children, but obviously goes massively beyond that. And I think LinkedIn must have had another question come in that says, the change of role in my family is impacting my adult siblings. I cannot be the fixer I was before for challenges with elderly relatives. Are there gentle ways to remind them I'm not okay? Or would this be a good example of butting up against their distress and the ripple effect you have described?
Yeah, because I'm not sure. What is the siblings' experience of the ripple? Are they kind of off in some corner so they're not feeling the ripple? Are they not aware of how hard it can be for Linton at times? Or are they experiencing it in a different way? Are they feeling their experience of the ripple is like, oh, we have to do more stuff now and Linton should be pulling their weight without understanding? So finding out what's hard for them is important, and trying to get on the same page and try and go to, okay, we all need to be adjusting, we all need to do things in a different way so we can get the best of ourselves helping with our aging parents. But finding out, it might be that the old rules of how it happened, who did what, who expected who to do what, that's the bit that needs updating. And no one's had that conversation yet. And no one can see how a stroke can make it harder for Linton to do what was done before. So getting heads around the table and just say, where are we now? How do we used to do things? How's that possible or not possible anymore? But can we do things in a different way so that the same endpoint happens? It's tricky. These are all really difficult conversations, but the key is the conversation. So just say, look, this isn't working for me anymore. Can we have a think together? Invite people to share ideas rather than just doing the same old on autopilot. I think that's key.
Yeah, and I think that another fantastic question we've been asked here is, I guess, around the subject of, am I the same person? And the person that's asked this question makes a really, really crucial point, that some relationships might be based around a shared purpose, e.g. playing tennis or working on a project, whereas others are based around, maybe a family relationship or a lifelong friendship that's been established over many, many years. And they make the point here that after stroke, it can be difficult to know, am I the same person? And this is different to, can I still play tennis, for example? So, and this can really go to the heart of the most difficult relationships. So, I mean, how can you decide? How do you know? Am I still the same person?
Oh, these are all the big questions, right? And what I would add to that is, in my couples work, there is a lot of important awareness building of how people, survivors can change, or I might be a different person, my identity or personality has changed. But it goes back to what else has happened to other people here. What gets overlooked is that many partners also would say the same thing about themselves, that I'm not the same person anymore. And so I've talked about, there's two-way personality change going on here. Everyone is different. This is the ripple. So yeah, maybe there's a significant change, or maybe that's being worked out, but that's not someone in isolation. What is it like for other people in the family to behold, to be the observers of that change, for the survivor? Could we have conversations like, maybe for that person, for the survivor, when do you most feel different to who you used to be? When do you feel closer to who you used to be before the stroke? What do other people in the family notice at those points? And they might have a sense of you being different at different moments around different things. I'll give you an example. I work with a couple where they called their stroke Chucky. Right, we're nearly Halloween, guys, aren't we? So their stroke was the little demon doll that would kind of, Chucky would never come out full on. It would go and bite people's ankles when they weren't looking. And for them, they were least like the couple they were before in the kitchen, because Chucky's domain was the kitchen. He would be the noise of the kitchen, or who's to the tidiness of the kitchen, or who does the dinner. That led to the most arguments. They felt the most unlike the couple they were before. That was full of Chucky. They could never get rid of Chucky because the stroke's there, but they had this idea that they could put Chucky on a extending dog lead, and on Friday nights they could go to the living room, put on the music they used to love together, get a takeaway, and just have a bit of a romantic evening together. Chucky was always going to be there, but they closed the door on the extending dog lead, kept him in the kitchen, and they could be more like themselves, who both had an activity and a purpose. They were listening to the tunes that defined them as a couple, and they felt closer to each other and a bit of a distance away from Chucky for that evening. So yeah, really interesting point. So it's the who are we, what are we doing, what we do defines who we are in different ways, but also who are we rather than who am I think.
Yeah. Another question that's come in. I had my stroke over 10 years ago. Are there techniques, or do you have advice for longer term stroke survivors?
Well, yeah, I always work backwards. Like, what do you want the technique to be for? What do you want to happen? And I think that's a rehab clinician perspective. We can reverse engineer this. We're like, okay, what's difficult? What do you want to do differently? And we see what techniques fits the activity or the goal. So I couldn't, without saying there's no all-encompassing thing. The all-encompassing thing is the point of this talk. Reach out to people, be connected, don't be alone. If it's really hard to be around people, what's the least hard way of being around people, either online or with one person or someone that you trust? That's my uber meta technique for everyone. Find a connection with someone. And then after that, it's what do you need to happen differently, and then it'd be working that out bit by bit.
No problem. Talking about finding connection with someone, just a couple of comments have had come in, and one of them is, sometimes support on an ear can come from unexpected places. One of mine was a holistic therapist who I see fortnightly. Any other perhaps unexpected people who've been most supportive? It's sometimes easier to listen when not too close to us as survivors.
Definitely, those are really important points. The and people who were in your life before the stroke may be less able to help certain things than newer people in your life after the stroke. Holistic therapies, as a Tai Chi teaching practitioner, I think holistic therapies, there's a whole range of therapies that bring people together in very different ways than perhaps in a healthcare setting or a social services setting like that. So yeah, the unexpected conversations that are the difference that makes the difference. You never know when that's going to happen. There's something magical about that, I think.
Yeah. And just a suggestion for you for a potential visual slide, seeing the slides that you had. Someone's put here, my neuropsych helped explain to me why things are harder, and use the analogy of an undamaged brain being a clear path, walking along a clear path in fine weather, but a damaged brain being trying to walk along a bumpy and uneven path with rocks and trees partially blocking the path whilst walking in sleeting rain.
I like that. That's amazing. Yeah, brilliant.
Okay, well, I think we've probably covered most of it and most of the questions today. Giles, thank you so much for your time this morning. It's been absolutely fantastic. We really appreciate the time that you've given us. Obviously, Giles has given his contact details. If you do have any queries to him, I know that he'd be very happy to hear from you, or please do look at his website. Similarly, if there's any queries that you have to us or anything that you'd like us to pass on to Giles, please feel free to contact us at our usual address, which is info@differentstrokes.co.uk. Thank you to everyone for joining us this morning. We've had fantastic numbers of people watching. We really appreciate it. Coming up this afternoon, we have a stroke survivor panel discussion on the invisible effects after stroke, which I'm sure would resonate to a number of people. So really very much hope that you can join us this afternoon. Okay, once again, thank you to Giles. Thank you all for watching, and we'll see you soon. Bye-bye.